Hello, I'm Michael Lambert at the Centre for Alternatives to Social and Economic Inequalities, and I'm here today talking about researching inequalities. So can I first begin by asking, who are you?
Okay. My name is Gwyneth Lonergan. I'm a postdoctoral Wellcome Trust Research Fellow in Social Science and Bioethics in the Department of Sociology. And before I joined Lancaster in 2019, I was the research associate on an ESRC-funded project, Understanding the Roles of Faith-Based Organizations in Anti-Trafficking at the University of Sheffield. And I was awarded my PhD in sociology from the University of Manchester in 2016. My PhD research explored the impact of local geographies on migrant women's activism in Manchester and Sheffield.
That's excellent. And so you've already talked about the span of the activities that you've been involved in over the previous sort of few years, but what is it that you do?
Well, broadly speaking, I'm interested in how citizenship, especially those areas related to biological and social reproduction, is experienced materially in people's everyday lives. I generally employ an intersectional lens in my research. I'm interested in how gendered and racialized discourses of citizenship are informed by neoliberal restructuring and what that means for citizenship and how it's experienced. So at present, I'm working on a Wellcome-funded project exploring migrant women's experiences of maternity care in the north of England. And I actually have a screenshot of my website.
The project website that you're running at the moment.
Yes. So there you go. And basically, I'm putting these experiences not only within the context of like the actual maternity care itself, but also putting these within a wider social context that's shaped by things like strict immigration controls, NHS restructuring, and the availability of local support networks that might also influence individuals' experiences of maternity care.
So that's your broad approach area of interest, then your sort of route into understanding inequality and its relationship to sort of the wider logics of society and the world around us. So how do you do your research? How do you go about getting under the skin of this?
Well, my current project involves a number of strands. So first of all, I am conducting a critical discourse analysis of relevant policy papers, which would include those dealing with NHS charging of certain groups of migrants, as well as NHS maternity policy like better births, and public health policy more broadly. And I use critical discourse analysis because CDA understands texts as the product of social practices, and importantly, analyzes these texts with reference to the wider social and historical context in which they are embedded and produced. And this is especially important with regard to immigration policy and citizenship policy, because we know that historical discourses and practices around bordering citizenship and belonging during the imperial and post-imperial period continue to exert considerable influence on discourses, practices, and policies today. Imogen Tyler, who is the head of department in sociology, and also Nadine El Anani have both written a lot about this. The other part of my project involves fieldwork with migrant mothers and with NHS staff. So I'm undertaking semi-structured interviews and focus groups with migrant mothers in Manchester, Leeds, and Kirklees, as well as NHS staff working in those areas. And when interviewing migrant mothers, I'm especially interested in their direct experience of maternity care, and also how the wider context of their lives shapes their experiences of pregnancy, maternity care, and childbirth. So, for example, one issue that has been raised a lot by my participants, especially those from Syria and Libya, is not being able to have their families, and especially their mothers, come to visit when they were pregnant because they're unable to get a visa, which is a small thing, but interestingly, when I speak to other British mothers about it, it's something they immediately identify with, how upsetting it must be to not be allowed to have your mother with you. And again, I have a quote for that. This was actually from the first woman I ever interviewed. And she just talks about, you know, she never thought that when she got pregnant and gave birth that her mother would be so far away from her. And interestingly, her mother-in-law, who lives in Europe, but is also a Syrian citizen, was also denied a visa. So there's a real sense of second-class citizenship almost. If you're from certain countries or your family's from certain countries, they will not be granted a visa to stay, whereas participants from other countries were able to have their family visit without as much trouble.
Okay, so can you give, from that kind of outset and the relationship between citizenship, health, states, bordering practices and forms of understanding, one example of how your work deals directly with these, I mean, it's with these forms of inequalities?
I mean, it's hard to just give one, because the findings from my current project demonstrate the way in which myriad factors impact upon migrant women's experiences of pregnancy, maternity care, childbirth, and the range of inequalities this produces. But for one thing, it is clear from my work that a person's immigration status has massive consequences for their experiences of pregnancy and creates significant inequalities in that experience. So people seeking asylum, for example, are generally not allowed to work nor to access benefits, but are reliant upon a parallel benefit system, the National Asylum Support Service. The housing in NAS is notoriously substandard. And so one woman I spoke to, due to a clerical error, during all of lockdown, was stuck in a one-bedroom flat with 2 children while she was heavily pregnant. And individuals are given just £5.66 per day in support. There's slightly more available for pregnant women and children under 3, but the women do not always know how to access this meager additional support. Also, an asylum-seeking person can be dispersed to a new city at any time. And again, one of my respondents was actually dispersed to Leeds 6 days before she was due to give birth. So when she felt labor starting, she went to the hospital by herself because her husband had to stay with their children. They didn't know anyone else in the city, and she didn't know any of the doctors or midwives. It was a very upsetting experience for her.
So it's profoundly, I mean, the image that you're conveying is about this enormous, profound disruption, but in a way that inequality at a singular level doesn't capture the full spectrum of the ways that it kind of interweaves together to kind of cumulatively reinforce these kinds of issues.
Yeah, I thought I was fairly cynical about like how harmful bordering practices are in the UK, but I actually failed to anticipate before I started this project just how widely they impact pregnant migrants' experiences. Like everything from, like I said, for asylum seekers, but not having family able to visit, no recourse to public funds for certain categories of migrant. One woman I interviewed found herself homeless with 2 children and pregnant when she was fleeing an abusive marriage, and the council was eventually prevailed upon to house her, but she spent the entirety of the pregnancy in like a hotel room with her 2 children. And yeah, actually in her case, her children's school stepped in to offer support where the local government was not, and the national government certainly wasn't. But then you also have things like language barriers really make a big difference in how people experience pregnancy. And also the ability to engage with the NHS. A lot of the stuff in Better Births really emphasizes the importance of women making informed choices and decisions, which obviously that's very good in many ways, but not all women are equally able to make informed choices. Women don't necessarily understand how the NHS works if they haven't been here very long. Some of the women I interviewed literally had PhDs in biology, and so had done like lots of their own research about what they wanted from childbirth, but others did not have that educational background and were not able to engage to that degree.
So you've already alluded to Better Birth, which kind of leads on to my final question about, can you talk a little bit about the organisations, groups, bodies, partners that you work with as part of the research that you do?
So first of all, this project is funded by the Wellcome Trust, which I think I mentioned before. In setting up this project, I did consult a number of migrant support groups as well as sympathetic NHS staff, some that I knew through my own migrants' rights activism, some through my PhD research, and some that I met when developing the project. And I asked them what were the key issues they would like to see explored, and language barriers actually came up a lot, as well as what other advice they'd have to give. So the medical staff consulted, for example, were able to explain what sort of framing was most likely to be taken seriously by other medical professionals. I was always intending on working with migrant support organizations during field work, but I've actually become more dependent than I initially expected on their support because of the pandemic. I haven't been able to just go to, an asylum drop-in and explain my project and see if anyone's interested in participating. And so the migrant support organizations themselves have had to be willing to contact potential participants on my behalf. So I'm not naming them specifically because I don't want to endanger the anonymity of any respondents, but I do really appreciate their support. And it's really, really important to me that the research from this current project can be accessed by migrants and their supporters, as well as NHS staff and other interested parties, in order to improve services for pregnant migrants. And so I will be holding workshops in the summer open to any interested party, where the findings from this project will be discussed, and we will work together to think of ways they can be applied practically to improve support for pregnant migrants. So I've already been in discussion with and had a lot of interest from like local maternity voices partnerships, who are very interested in finding out how they can better support pregnant migrants in their areas. I do think it's worth pointing out, however, that while maintaining these relationships is really important, it can be especially difficult for early career researchers, not only because of workload, which is something I think everyone in academia has to deal with, but because ECRs move around a lot. I've worked for 3 different universities in the last 6 or 7 years, and I've actually had a much more stable career than a lot of other people I know. So, for example, I was on the steering group of Manchester Migrant Solidarity for a while, but then when I got my job in Sheffield, I had to resign my position because I just didn't have enough time. I wasn't living in Manchester at that point, and I didn't have enough time to attend the meetings, which were held during the day, during working hours.
No, I completely agree on those kinds of embedded networks and how you kind of fit within them in sort of doing it and taking research.
Yeah.
It's integral to the process. One of the other things that it really spoke to me about what you were discussing is the relationship between what you're studying, how you're studying it, and the ramifications of the research in terms of these workshops later on. Because with the current policy agenda, perhaps moving more towards population-based dynamics, place, and inequalities, that there's a real moment where you have a grounded piece of empirical research that is anchored both in its organizational context, but also the wider theory to have tangible impacts and changes for the people that it affects.
I mean, I'm a bit cynical about the national government level, which was not helped by the critical discourse analysis I did of government policy papers, I have to say. I think in the Department of Health consultation on NHS charging, there's actually a section where they say that they recognize that introducing strict visa checks in hospitals will lead to some pregnant migrants avoiding accessing care and could therefore put their life in danger. But that they basically actually explicitly say this is a risk they're willing to take in order to present so-called maternity tourism, which they also acknowledge they're not sure is a thing that is actually happening. But I do think that there is definitely potential for local government being interested in how they can better support pregnant migrants, especially with devolution and sort of Greater Manchester in particular, having control over its own health and social care budget. And I think there are a lot of community organizations and groups like Maternity Voices Partnerships, who are interested in finding out how they can better support pregnant migrants and sort of counteract some of the consequences of these policies.
So it's almost as if you're kind of seeing the benefits of that bottom-up dynamic.
Yeah.
No, I think that from an alternatives perspective in terms of inequalities, I think that's a very, very important bit, and it seems to permeate every aspect of both your research, but also your personal and active involvement in these kinds of organisations and political issues. Gwyneth, thank you very much.
You're welcome.